Well, Ireland has a long history of regulation. The independent state inherited a number of regulators in 1922 and rapidly established new regulators in the areas of censorship, education, medical care and so on. But I think what we see in the pattern of the past is that the intensity of regulation around certain key areas was not all it might have been. And when you combine that with the experience that Ireland was delivering services often through voluntary organisations, we might say that there wasn't enough focus on how to ensure the oversight and the learning about what could be achieved in the areas such as health, education and so on. I think there's a number of aspects to how we might think about regulation today. The first is building some central capacity within government to understand what is going on in regulation, what the challenges are. Take the area of enforcement, for example. There's very diverse practices around different regulators about how to enforce, how to secure learning and understanding from those that they're regulating. And government isn't at present committed to having a central oversight facility for regulation. The OECD guidelines published in 2012 recommend both strong policy commitment and also a centralised capacity to oversee what is happening and to learn lessons across sectors. And that's at the moment what is not happening. And to restore some kind of central oversight for regulation would be, I think, significant. Second thing is to see our regulators not as command and controllers, but as actors within broader networks of actors, working with firms, with NGOs, with government, to try and stimulate better understanding across many actors so that we don't place excessive dependence on what regulators might do through command and control, but rather see them as key actors within broader networks for better understanding what's going on and for better securing delivery of public interest outcomes. Well, there's two different dimensions, I think, of the voluntary bodies. There's first what I call the specific sectoral regulation. So, for example, in the healthcare, we see HIQA, the Health Information Quality Authority, having developed a quite specific and rather successful role, both in developing and monitoring standards, both for public and private providers. In education as well, we see specific sectoral regulators. But we also then see the general regulation coming out of the new charities regulator. I think we are going to learn a lot from what the charities regulator does. The voluntary organisations themselves say they are ready for more stringent regulation because of difficulties they've had around demonstrating effective oversight. Whether they can meet the expectations, whether the regulator is sufficiently resourced in order to be able to do the things it wants to do, I think time will tell on that.